The views expressed are my own and do not reflect that of my current, past, or future employers or any of their representatives. The information discussed is for informational purposes only and do not reflect medical advice. Instead, always get the advice of your own medical provider.
Right now, we've got astronauts preparing for deep space missions. But what's really interesting isn't just the rocket, it's what's happening to the human body when it leaves Earth. Segment number one, the body in space. And what I see right now is astronauts, and they're actively working out in space. We got one astronaut. He's looks like he's running on a treadmill, and then we have one astronaut. He's doing deadlifts. So I want you to see this. This is what I'm looking at. So you see this picture here. These astronauts, they're doing this workout, and this is the body in space. By the way, that's my outline for the podcast, no doubt about it. But still giving you the same information. But that picture is worth 1,000 words. And why do I want to show you that picture? Because here's the deal: astronauts, they lose 1 to 2% of bone density per month. Bone density is very important. If you have a loss of bone density, then you have essentially osteoporosis. If you have osteoporosis, then that means you essentially have brittle bones. You don't have enough bones. And if you don't have enough bones, then you're at risk of, if you don't have enough bone density, then you're at risk of, causing harm. If, falls, and even the smallest little things can actually cause a person to, lose bone health. And so I have another picture of the actual osteoclast of how osteogenesis begins, and that's like the creation of bone. And so if you don't have it, then you're at risk of having, like I say, injuries. And people that have osteoporosis, they know all about that. So in space, if you don't use it, you lose it. And the same thing happens to us, just happens slower. So this ties into people that have a sedentary lifestyle. If you have a sedentary lifestyle, if you're not putting any pressure, on your body, then as a result, you have a sedentary lifestyle. So in other words, think about healthy things, they need to be pushed. And that's just kind of what it is. Healthy people need to be pushed. And as we get older, we need to be pushed even more so in order to see results, in order to not have any harm done. So that's just something to think about. And why astronauts, while they're in space, and I think I was looking at TV, they have we'll get to that later. But muscle loss and movement. If there is no gravity, you have no resistance. Resistance is very important. As a matter of fact, that's why we preach it in primary care in medicine. Resistance training. It's very important because it helps stimulate muscle creation, right? You have muscle, you have more mass. If you have more muscle, you actually have a higher metabolism, right? You're able to move, better. So if you have no resistance, then obviously you're going to lose muscle. If you don't move, then you're going to lose muscle. And so space is like the environment where that happens more than anything else, because the thing of it is you're going to have no resistance in space. There's no gravity. And so what happens? Muscles, they weaken fast, right? Your body is built for resistance. Take that away and let's break it down. Your body is built for resistance. So once again, I see it a lot, atrophy is what the term for like dying tissue means, atrophy, right? And so if you don't use the muscle, then frankly, you will lose it. And it happens fast, even on Earth. So in space is so much more important. So you think about it, like a big part of the astronaut's day is getting some muscle resistance. I mean, I was looking at it. They have one piece of equipment that I can think of. And basically with that one piece of equipment that the astronauts are using, they're using that to do deadlifts, and they're also doing rowing. And, rolling is a great cardiovascular exercise, but it's also muscle resistance. There's some resistance to it. Deadlift, same thing. It could be good for cardiovascular, but it's also some muscle resistance involved as well. So the big thing is that it is very important for you to get that muscle resistance, that strength training. As you get older, you lose that muscle strength. Welcome to the show. Give me a like. This is just creating a podcast. So as you get older, you do lose muscle strength. And as a result, if you're over the age of 40, you're at a higher risk of losing muscle strength. And so the astronauts in space, they're in a confined area. And of course, they have things to do, in order to prepare for their mission and make sure everything happens. And they're, in communication with NASA. They're going to be doing photos and interviews in space. But the big part of their day is muscle resistance. It's also strength training, right? And so that's very important for even the astronauts. So how much more important it is for us when we think about it, we're here on Earth. If we can make sure that we can do some muscle resistance, and we can not have and we have a active lifestyle. And frankly, this is going to be to someone's ability. Not everyone can do 10 deadlifts, right? But to a person's reasonable amount, what they can do. And frankly, the higher the weight doesn't necessarily mean it's a better weight, right? The more weight, the more pressure on the joint. And so really it's just the opportunity of doing it back and forth. You want those muscles to continue to work and get some, get some creation of muscle mass while you're doing it. So that's very important. Let's talk about another reason why the astronauts need to make sure that they are, working out. They need to do that because you got heart and fluid shifts, okay? The heart shifts upward in space and blood doesn't work as hard, deconditioning. So think about it, right? Without that resistance, if the blood always shifts up, there's no gravity. The blood, I guess you think about it, the blood going from arteries, especially arterial, that's going away from the heart. There's not as much pressure, right? There's not enough pressure, and so as a result, it can get weakened, right? Even your heart needs stress to stay strong. Think about that. So when you think about the heart, right? Great, really muscle, right? So when the heart comes out that left ventricle, that's the left lower side of it. That's where the mighty pump goes. So anyway, as the blood leaves the heart and it goes throughout the body, that is stress for the heart to do, right? And so if your heart gets used to not putting up any resistance or not seeing any resistance, that means that as a result, your heart's not strong. And then whenever you get back to Earth, now we're going to have this kumbaya moment, for lack of better terms, for the body, because now you're dealing with gravity again. So the heart's going to have the resistance at that point. So very important for astronauts to move, think about the heart. So that's why the workout is so important. So cardio health and deconditioning in chronic illness, we see it a lot. Cardio health. We need people to do cardio health. That's going to be a very big thing folks do. So cardio health. What is cardio health? Cardio health, the easiest cardio health really there is walking, right? That's cardio health. Squats, and even squats with your body weight. If you do it repetitively, cardio health. Burpees, that's cardio health. If you want to play some basketball, football, soccer, whatever, cardio health, that's what it is. And so as you're doing that, the more stress your heart gets, but of course, that's going to allow the heart to be strong, right? So even the heart needs stress in order to stay strong. Just kind of think about that pathologically. It makes sense. So what about the next step that the astronauts are up to while they are in space right now, going to the moon? Mental health and isolation. Astronauts, they deal with confinement, stress, and sleep disruption. Although I have a newborn, well, 3 months at this point, I know about sleep disruption and sleep hygiene. And it's a fact, when you don't get sleep, endorphins, hormonal changes, you're not getting, the production of your hormones that usually lead to well-being, as well as muscle strength, so that becomes a issue. Stress. If you got stress, you have cortisol, which is released, which is the stress hormone, weight gain. mental fatigue, fog, so that happens. And then you're dealing with confinement. And when you think about confinement, that's why it's so important to try to socialize, try to, talk to people, even if it's on social media. It's very important to not be isolated. Even the most elite humans struggle mentally when their environment isn't right. And so, I guess, there's a new push in the athletic world, which is to, mental health is very important. And what do you think about that? What's your thoughts about that? I think it's pretty fair to say that, it's good to have therapy around other people, good people that you need that bring the best out of you. It's very important for you to be around them. So you think about the astronauts, they are away from their family, they're away from their loved ones, and they really are isolated more than any other humans in history because they're going to be going further away. And so how can we tie this into everyday life, burnout? I mean, if we're not getting enough sleep, if we're not getting enough association, and you're dealing with stress, chances is you're not going to be feeling that good. And many patients, deal with that. They are not feeling that good that we see. And lots of times we got to ask, is it a lack of sleep? Is it stress that's causing it? Is it confinement? They just stay in the room one day. Let me tell you this, lots of patients that I see really, they got problems with sleep, myself included, in one room. And that area has the bed where they sleep in. And so they're there all day. They're not, going anywhere else. They're not doing anything different. And frankly, they have a hard time sleeping. And you know what I tell them to do? I tell them, hey, you need to change up your daily pattern. You need to change up your sleeping habits, right? You need to, in other words, get out of the room or move to bed, sleep somewhere else. There's lots of studies that prove that by just, leaving where you normally sleep and sleeping somewhere else. If you do have insomnia, which is a lack of inability to sleep, then one treatment is to change up your sleeping routine. You only need to use the bed for two things: sleep and sex. That's the only two things bedroom bed should be used for. And so it's not a good habit to lay in the bed, watch TV, eat your dinner, talk to everybody, and then try to sleep in the same bed. So the astronauts are dealing with that because they are in the same bed, they're in the same room, but it's so important for them to stay. I mean, you think about it, they're not completely isolated, they're with one another, and they're getting physical activity and they're eating good. So food and routine, why is that so important? A strict diet, structured exercise, 2+ hours a day. Astronauts don't rely on motivation, they rely on systems. And I was thinking about that. I was putting this podcast together, like NASA, like they have, two systems set up, and of course all of them I don't know, but I've seen it in my life, like if it can go wrong, it will go wrong, right? That's what I see in my practice. But I got to tip my hats off to NASA because, to prepare for every single possibility of a malfunction, I mean, that's a big deal. I mean, to have a backup plan to a backup plan to a backup plan. Like if this system doesn't work, we're going to go this system. If that system doesn't work, we're going to go that system. So, the astronauts thrive, once again, on having that diet. They have a diet usually like protein heavy, and they have water. They have, whatever else, carbohydrates, good fats. And apparently they have enough calories to where every astronaut can get between 2,500 to 3,000 calories a day. I think that's a big deal. And so when you think about the structure and the food that the astronauts rely on, the systems that are in place, I mean, that's great. And that ties into discipline versus motivation and versus lifestyle medicine. So, use your lifestyle as a medicine. So your lifestyle is how you're gonna respond to stress. And then discipline. So can we be disciplined enough to try to eat a healthy diet? Try to eat some food that will be, build us up rather than not. I think that's a big deal. That's something to think about. just something to think about there. And so let's bring it home. What astronauts experience in months, we experience over years, and it's not intentional. And in this case, the astronauts, what they deal with in a day or 10 days is not, it's what we deal with in years. And so when you think about it, from day 1 to day 10, they really have a system in place. They really, taking care of their health. So I would say it's a great thing to look at what the astronauts do. So my tad bit takeaway, let me just tell you this, the tad bit takeaway. What's fascinating about space travel is this. The human body wasn't designed for comfort. It was designed for challenge. It's a big deal. In space, without gravity, the body starts to break down, bones weaken, muscle strength, the heart slows, and the truth is the same thing happens here on Earth, just more slowly. So the takeaway is simple. Move your body, challenge it, fuel it well, stay engaged, because your health depends on it. If we can learn anything from the astronauts, it's that structure, discipline, and awareness are what keep the human body strong, no matter where you are.